Welcome to the Miller Report, Real Clear Journalism. I'm Maggie Miller. Today we're discussing a first-person account by a former Duke Health doctor who says he lost his job for questioning the institution's diversity, equity, and inclusion agenda. Dr. Kendall Conger worked at Duke Health for 10 years. In 2021, they declared racism a public health crisis and adopted what it called an anti-racist pledge guided by science. But Conger says that when he asked administrators for evidence, they could not provide medical data, and said he was given studies showing racial outcome disparities, none proving implicit bias was the cause. Conger describes how raising these concerns led to backlash. After a conversation with a nurse about implicit bias, he was reported, summoned to HR, and told his speech was unsafe. He was ordered not to discuss the pledge on Duke's property. Following several more attempts for policy clarification by Conger with leaders of Duke Health, on January 1st, 2024, he was terminated, not for cause, but labeled for disruptive behavior. That firing triggered a state medical board review, which ultimately found no violation. He says finding new work was difficult, but was eventually able to practice on contract at a hospital more than an hour from his home. Meanwhile, Duke has quietly shifted its policies. This year, it dropped its 2021 anti-racism pledge and replaced it with a new statement of values titled Leading with Heart, Rooted in Humanity. Conger calls this reversal a validation of his stance against what he considers divisive ideology masquerading as science. His story is now part of a lawsuit against Duke, as the university also faces a separate federal civil rights lawsuit and a freeze of $108 million in funding over alleged racial preferences. We're joined now by Dr. Conger to further discuss his story and its implications. Kendall, thank you so much for joining me.
My pleasure.
So in your initial fight with Duke leadership, you took issue in ideology being put forth as science in the medical setting. Could you explain that?
Yeah, it was really strange. I thought I was there, just to practice medicine, and then they were starting to put political views on me. I was like, well, how does this advance curing cancer? How it's what these are your political values, and I just didn't think that was appropriate. And it was one thing if they wanted to say, hey, this is who Duke is. Okay, fine, you can let me know that. I think that's a little overboard, but then it's quite another to say, and you need to think this way too. It's sign on to our pledge, and so that I took issue with.
So, did you see the DEI winds shifting at all before the Trump presidency, or was it not until after that you felt you had standing to seek retribution? What does that retribution look like now?
Yeah, right. So I did not know how the political tide would turn or not turn. It was very fortunate that Trump got elected because almost immediately he issued 3 executive orders calling DEI immoral, illegal, and discriminatory. And it was especially the discriminatory part that caught my eyes. I was like, yes, absolutely. That's what I tried to tell Duke. I said, when you favor this group over another group, it's just a new form of discrimination. When they are shifting resources and grants and funds to one group. And it also struck me that their reasoning for it was bizarre. It's, we have to help this group because you as a white person unconsciously are hurting these people. And I was thinking to myself, how do you know what's in my unconscious mind? But anyway, so, and then subsequently, Trump has frozen $108 million in funding to Duke based on their equity policies. And so I felt vindicated for one, but I was hoping this would help my case. Initially, my case was that I was retaliated against and for wrongful termination. I was hoping actually that this would be more of a whistleblower case, which was, I felt they were doing something illegal by their policies, which again Trump said as well. But actually, it turns out as I've looked into it further, I may not have much of a case because of the arbitration clause that's in there. So I may be limited there. I'm still looking into it.
Okay, and so obviously for years, people thought that STEM was immune to some DEI practices because obviously, rightfully so, it is a merit-based field. And then some science came in, radicalized, as shown in the messaging that Duke was putting forward. With the changes in policy we're seeing today, can we get back to that version of science from before, or is this way of thinking very deeply ingrained in the fabric of STEM now?
Oh, that's a good question. I'm not in the academic portion of Duke. I really was just practicing my medicine without doing research at this point, and without knowing how they are advancing their ideology. I know it is deeply embedded in the medical schools, in the organizational leadership, but I think the people who are on the ground, the boots on the ground, prefer just straight medical research. But unfortunately, how things go is if the money is saying we want you to find racism, well, research will start looking for racism. But I hope that will be a thing of the past.
Not even just with regards to racism and like research. Do you find that with the way that Duke Health was, set up, the leadership obviously believed what they were saying was what is the truth? Do you think that it's so deeply ingrained, and also other medical professionals like yourself who were told these things for the past 2-3 years, and now that's something that they're consciously thinking about at all times?
Yeah, actually, I'm not so sure how firmly the scientists at Duke believe this ideology. It really appears to me that it was HR driven, that it was more the tail wagging the dog. For instance, every doctor that I worked with in the ER, we were all saying the same thing. This is crazy. What are they talking about? All we try and do is we want to help save lives, and any negative outcome on any patient looks poorly on us. I think they were almost forced, these scientists and these in academia we're almost forced to go down this road to go along to get along kind of thing, or this is the way the political winds were blowing. But I don't feel like the people I worked with was really behind this.
So you were just one of the few that was actually, pushing back and speaking out about it. I wanted to touch base a little bit on the fact that obviously the argument is that there is a disparate outcome impact facing people of color in health, saying that those outcomes are attributed to systemic racism. That was the messaging that Duke Health was echoing to you. Is that true, or do you attribute those outcomes to something different? How would you fix that issue?
Yeah, the disparate outcome looks real to me from everything I read. But to me, the problem was they were saying it was because of my unconscious racism and because of all of white people's unconscious racism. And so when you actually look for the data, it wasn't there. I don't even know how you do a randomized double-blind, placebo-controlled, real medicine trial or something like that, because you would have to know what was in somebody's unconscious mind to be able to determine if that affected their behavior. It was unfalsifiable. What they were putting forth was unfalsifiable. And I kind of lost a little bit. I forget where I was going with that. If you can repeat that part of it.
And the second part of it is, how would you fix the issue of seeing these disparate outcomes?
Yeah. The disparate outcomes, I think, is more related to culture, So here's the thing. Let me give an example. We know that if you want to decrease poverty, what works for all people is this: graduate from high school, get a job, and don't have children until you're married. That applies to everyone. If you're breaking any of those rules, white, black, brown, whatever, you're not going to do as well. So we know there are certain factors that will help everyone. So to me, it's almost like, hey, change the things you can change and see how that works.
In your piece, you cited some, I believe there were philosophers saying that we need to look at the similarities between us as opposed to the differences, and that's going to help us move forward. Is that what you're trying to explain right now?
Yeah, so actually that was Jonathan Haidt, and I absolutely loved what he had to say, again, because it seemed like such common sense, which was if you meet somebody, really you're looking to connect. You're not looking for what separates you, you're looking for what joins you together. And even if a person says, hey, my birthday is January 3rd, my birthday is January 3rd too, hey, isn't that great? You want to get to know somebody where you can agree and where you can come together. But it seemed like it was just the opposite mindset with Duke. It was how's one person harming another? Always look for the harm. The default position was, where is racism occurring in this interaction? How did things go poorly? Where was there oppression? Rather than, hey, how did we get along? Where was it that we connected? Where was it that what was it that brought us together? So I just think the mindset is just completely antithetical to good society.
So obviously, your situation escalated from sharing your dissent to being terminated. How has that affected your career long term? Obviously, you cited some difficulties that you had then trying to move on to your next venture and that sort of thing.
Yeah, it was difficult because, initially when I started looking for jobs nearby, and actually, again, this is interesting. The medical people I talked to, who I was first speak with medical directors, and we would get along and they would want to move forward, but then my application would move to HR, and the next thing I would hear was, "Hey, we can't go forward, anymore." And some of them would tell me, because actually with some of them I would say, "Hey, look, let me be upfront. This is what's going on," and they're like, "We don't care. I agree with you." Yet they would get back to me and say, "Well, I guess you know what happened, right? HR got a hold of my application." So that stalled. I ended up having to, rather than be an employee, because I don't think these places wanted to employ me, to employ a person who seemed like a problem causer. So I had to go through a agency that they employ me and then they contract me out to the hospital. So I was a contractor instead of an employee.
So what do you want to leave people with as we wrap things up? And what are you looking at with regards to the future of DEI?
I think the future of DEI is that it is a sick patient and is not going to do well. It may gasp along, but I think there's no going back. I mean, I think once you've tried the 5-year program and you've ended up with famine, that people just don't want to go back to this. It seemed ugly. It was unhelpful. It was costly. It was divisive. So going forward, I hope it's a return to normalcy.
Well, I appreciate the medical analogy right there. Kendall, thank you so much for your time.
It's my pleasure. Thank you, Maggie.
That was it for the Miller Report, Real Clear Journalism. I'm Maggie Miller. I'll see you next time.